So early in my medical professional career, I treated a lot of patients with autoimmune diseases. Either the disease that they were suffering or the medications that I was giving them to treat their diseases, they experienced a lot of hair loss. And I know the heartache and the devastation that they feel when they are experiencing this. So I've made hair restoration my primary focus because of two reasons. Number one is that I enjoy it. And fortunately, I'm very good at it. Number two is that there are a lot of people that suffer from hair loss, and it can be very devastating. So when patients come to me, I have a very strong empathy for what they're going through. So I started my surgical hair restoration career with a surgical technique called follicular unit extraction. This is a surgical technique where we take individual hairs one by one and from the donor area in the back of the head. Great method, however, one of the biggest limiting factors with follicular unit extraction is the amount of hairs that you can move. However, I was really excited to expand my practice in offering to move more hair in a single procedure. And our patients are, in the end, much happier. So the ideal patient that is a candidate for hair transplant surgery will, number one, have adequate donor, and probably more importantly, have realistic expectations of what we can do for them. And number three, someone that will follow post-operative instructions to the T. We want to avoid the thought process where you can just have your hair transplant and not need to worry about anything else. When we perform surgery, we put long-lasting hair from the donor area to the recipient area, but it does not protect the existing natural hairs on the top of your head. This is where medical therapy comes in. Because otherwise, if we transplant this area and then you continue to lose, then you're going to have nothing behind it. So it's very important that you maintain what you have and that we're adding to your existing hair and not chasing our tails. So probably the most effective therapy out there is a medication called finasteride, otherwise known as Propecia. It is a true DHT blocker and it's very, very effective. Another thing that's available is something called minoxidil, otherwise known as Rogaine. It's a topical medication that you place on your scalp twice a day for men, once a day for women. It's a little more labor intensive, but it works very well. So other modalities that can help is low-level laser therapy and PRP. And you can do all four of these at the same time. As a matter of fact, the more you do, the more effective the result will be. So the most important aspect about hairline design is making sure that we individually tailor the hairline to frame the face. So what I look for is where the two planes meet. There's definitely a flat plane in the front and a plane on the top. And where those two meet, it creates an edge. And once we find that, we can tailor a hairline that looks very appropriate and very natural. So my advice, if you're looking for someone to perform your hair transplantation surgery, you need to think about the entire team. You can have the best surgeon in the world. However, if their hair technical specialists are under par, then you're not going to get a result. Hair transplant surgery is one of the surgeries where you need more than just the surgeon itself. Every part of the team has to be very good and very experienced. So the team I work with here at PAI are some of the most experienced technicians. They have many, many years of experience doing hair. So for our patients, I'm very confident that we can deliver some of the best work that can be done. So the absolute favorite part of what I do is seeing our patients' results after a year's time. I see our work and I see how they feel about it. We took someone that had no confidence whatsoever and then they come back and they have all the confidence in the world. And that makes me feel very good.